Why does silent reflux, LPR, cause Globus sensation? Imagine feeling like there's a lump or tightness in your throat that just won't go away. It can be confusing because you might not have the usual signs of acid reflux like heartburn. This is often what people with silent reflux, also called laryngopharyngeal reflux, experience. Silent reflux is different from the typical acid reflux that causes burning in your chest. It mainly affects your throat and voice box, not your stomach or chest. So, why does silent reflux cause that persistent feeling of a lump in your throat? It all comes down to how stomach contents travel up into the throat area. Even a small amount of acid, bile acids, or digestive enzymes like pepsin can reach the throat tissues. These substances are harsh and can irritate the delicate lining of your voice box and throat. And like the esophagus, which has a thicker lining, the tissues in your throat are more sensitive. This irritation causes inflammation and swelling, which can make your throat feel tight or like something is stuck there. Another reason is that when refluxed material irritates the tissues, it can cause them to swell slightly. This swelling narrows the space in your throat, making you feel like there's a lump or tightness. Sometimes, the reflux triggers a reflex through the vagus nerve, which runs from your brain to your stomach and throat. This reflex can cause your throat muscles to tighten or become more sensitive, even if only a small amount of acid reaches the area. LPR can also increase mucus production or cause post-nasal drip, which adds to the feeling of fullness or discomfort in the throat. If you use your voice a lot, like singing or teaching, your vocal cords might become more irritated and sensitive to reflux. This can make the Globus sensation worse. Most people with silent reflux do not experience the classic heartburn. Instead, they notice a persistent or intermittent lump in their throat, sometimes along with hoarseness or frequent throat clearing. Doctors who specialize in ear, nose, and throat issues can examine your throat with a small camera called a laryngoscope to look for signs of inflammation or swelling. Treatment usually involves lifestyle changes like avoiding spicy or fatty foods, losing weight, and not eating before bed. Medications that reduce stomach acid can also help. Sometimes, voice therapy is recommended to relax the throat muscles. When managed well, the Globus sensation often improves or disappears. In short, silent reflux causes Globus sensation because the refluxed stomach contents irritate and inflame the tissues in your throat. This irritation triggers nerve reflexes and swelling, creating that uncomfortable feeling of a lump or tightness.